Good morning. Here is Dr. Madhava Rao. I'm a consultant ophthalmologist vitreoretinal surgeon at Burjeel Hospital, Abu Dhabi. Today I'm going to speak on diabetic retinopathy. The diabetic retinopathy prevalence is quite high in this part of the world, and it affects the working age group between 40 and 60 years. Diabetic retinopathy affects third of a patient of diabetes mellitus at any given point in time in their course of diabetes. Diabetic retinopathy is a microvascular complication that affects the small blood vessels of retina, likewise in kidneys and other organs. Diabetic retinopathy can cause a blurring of vision to a severe loss of vision or blindness if untreated. Blurring of vision or a vision loss can happen in diabetic retinopathy because of two reasons. One, a swelling of a central retina called diabetic macular edema. Second, it can happen because of the new vessels which cause bleeding into the eye cavity called vitreous hemorrhage, which can further lead on to a retinal detachment called tractional retinal detachment. The abnormal vessels can cause leakage of fluid and proteins into the retinal layers, what is termed as diabetic macular edema. The diabetic macular edema patients can present with a blurring of vision or patches of non-seeing areas called scotoma. Second complication is occlusion or incomplete blood flow through the abnormal vessels in diabetes mellitus. These occlusion can lead on to new vessel formation, and these new vessels can bleed even with the slightest of physical exertion like bending forward or lifting any heavy weights, and can cause a bleeding into the vitreous cavity or the eye cavity called vitreous hemorrhage. The vitreous hemorrhage further can deteriorate. The membranes which form because of the new vessels can pull up the retina and can cause what is known as tractional retinal detachment, leading on to a blindness.